The best thing about the clinical fellowship program is that fine balance that's there between work and education and career development. The second thing is the flexibility that this program offers to the doctors. It gives clinical fellows the opportunity to identify their strengths and then supports them in building that strength and that skill set in order to progress in their respective careers. But one particular thing that stands out is there are certain skill sets that are not available locally. So you need to be seconded to another trust where that particular skill set is present. The CFP made it all nice and smooth for me, that the whole experience was very beneficial. I did not suffer a pay cut, I did not suffer any other disadvantage. So this shows me that RWT went that extra step. It had that confidence in me working at a consultant level and how far the trust can go to help support my career progression.
My story is a bit different from the normal international nurse that joins the trust, where I was already in the country. I joined the trust then in 2016. I got my PIN in June 2018. I then went on to decided 5 months later the first clinical fellowship program came about, and I interviewed for that and I was successful. And my plan was to leave trauma orthopedics, do the clinical fellowship and go into teaching. I then applied for a matron's post and I was successful and became a matron in November last year. My role now is, as much as I would love to be hands-on in the maternity unit, I think from an international perspective, you know, everything the trust did for me, I can now give back, and I can do it for the girls we're bringing into the country and make sure that their journey is 100%. Mine was brilliant, but make sure theirs is amazing.
My favorite part was coming to the boot camp. It was amazing but I think the diversity and the community that I felt in boot camp was exactly what I needed. There was such unity and community in such difficult times, and I say that honestly. But our facilitators really made sure that we were well taken care of. I just felt like that was so crucial. You can be whatever you want to be. You know, coming back from South Africa, nursing for me was just bedside nursing, and I come to the UK and there are like 15 different avenues where a nurse can go into. I mean, I thought of doing things that I never thought as a nurse I could do or I could specialize in. One night I'll sleep and I'll think, okay, I'll be a clinical nursing educator, and tomorrow I'll be like, no, I want to be a matron. And it's possible. Like the opportunities and the possibilities are endless.
I undertook the clinical fellowship program. I wanted a period of time away from the usual training pathway, and the clinical fellowship program provided me with that opportunity. I'd had the opportunity through the clinical fellowship program to gain experience in service development and also run sort of academic experience alongside that, particularly around areas like quality improvement and leadership. So I'd absolutely recommend it to anybody that's considering it. It's a very flexible and supportive program.